Hi guys, welcome to Health Elevated's Bladder Diaries. We're going to talk about our guide to better bladder control.
So let's dive in. This is our quick disclaimer. Read it. It's really important. Let's get started. So what should my bladder do?
This is really important to know, and it's not something that's commonly talked about, so a lot of times people don't know. One of the first things that I like to talk about with patients is frequency, about how often in a day should you be going to the bathroom. And the norms right now, they are saying you should be urinating about every 2 to 4 hours, waking hours. And
Yes,
you should be able to, if you are under what they call elderly age, you should be able to go throughout the night, an 8-hour night of sleeping, without having to get up to urinate. If you are within what they consider to be elderly, and different studies some start at 65, some start at 75, so it's kind of variable in there. But then they say still no more than one time per night should you be getting up to urinate. And so that's going to equal to about 8 times or less in a full 24-hour period. And a lot of people have no idea how often they go to the bathroom. So if you're watching this and you're thinking, well, I'm not sure if I'm in that range or not, over the next few days, kind of try to keep track and pay attention and note, and some people, their frequency is different in the morning compared to the afternoon or more or less.
Or they might find that their frequency changes depending on their cycle, too.
Yep.
Closer to your period, you may find that, hey, why am I going to the bathroom so frequently? And then when your period is done, you're like, oh, it's back to every 3 to 4 hours. Also, there are those people who are like, I can't remember the last time I went to the bathroom. It's been, I've worked all day. If it's been a solid work day, then, we really want to start thinking about, adding in some more bathroom trips for those.
And the other thing that a lot of times will have people track is a work day compared to a home day. That's another place that we can see a lot of differences. So again, our goal is that every 2 to 4 hour range. If you are going more frequently than every 2 hours, you're either getting some false bladder urge signals, which we'll get into that in a little bit more detail, or just out of habit, you may have trained yourself that you need to go more frequently. And if you're going less frequent than every 4 hours, there's a good chance that we're likely dehydrated as well. So again, we're going to get into all of this in a little bit more detail as well. But just, what is normal? Every 2 to 4 hours and sleeping through the night.
Those are our bottom lines for that one. So there are actually 2 different types of incontinence. People talk about how they're having trouble with leaking, but they don't really always understand that there are 2 different variations of it. There is stress incontinence, but there's also urge incontinence. And they are very different in how they come about and also how we treat them.
Yeah, the mechanisms behind each are very different. And then there are a few minor types of incontinence as well that we won't get into a lot necessarily in this video, but that's definitely something that there's something you can do about, and B, might be something that you could reach out to us or a local pelvic floor therapist. So, we do also see people with complaints of coital incontinence where the only time they're leaking is during intercourse. We will talk a little bit about post-void dribble incontinence. I see that a lot in my prostatectomy patients as well, where the only time they're leaking is, very soon after having urinated on purpose in the toilet. There's some overflow incontinence and stuff that gets into some neurological diagnoses. But for your average person that is watching this video, the 2 main types that we're going to really get into is that difference between the urge incontinence and the stress incontinence. So let's talk about what is the main difference between these 2. Urge incontinence is described as, I get a really strong urge and I need to go to the bathroom right now or I am going to leak. Typically, but not always, with urge incontinence, it tends to be a larger amount of urine. A lot of people can identify their triggers. The sound of running water,
seeing
a bathroom door, driving and just mentally knowing that there's not a bathroom around, can be really common triggers. Oh, coming home. first, pulling in the driveway is a really, really common trigger. And that is a completely different mechanism than stress incontinence. So with urge incontinence, it's not necessarily that your pelvic floor muscles are so weak that you're leaking, because your bladder is actually purposely contracting and expelling that urine. Your brain should be telling your bladder when it's okay to go. And in urge incontinence, your bladder is telling your brain, hey, by the way, I'm going. So just treated very different than stress incontinence. You want to talk about stress incontinence?
So stress incontinence, I like to think of as more of a coordination issue. So when our bladder gets full, in order for us to use the bathroom, our bladder, which is a muscle, has to contract, and our pelvic floor muscles, which sit underneath it and support the bladder, they have to relax to let the bladder empty fully. If those pelvic floor muscles are too tight or not coordinating well, things like impact. So people talk a lot about jumping on a trampoline is a big one that everyone kind of resonates with, or doing jumping jacks. Also, like coughing or sneezing, it's related to how our bladder and our pelvic floor coordinate. If our pelvic floor muscles are too tight, they can't absorb that impact. So when our bladder squeezes, it leaks and things, basically urine, comes out. So we want to work on helping those pelvic floor muscles coordinate better, so that way they can absorb the shock when we're doing those kind of stressful activities. So stressful activities, think like jumping, coughing, sneezing, running as well can be related to it.
Absolutely, absolutely. The way I like to describe it is basically the pressure stress above your bladder is higher than the pressure support below your bladder, and therefore you are leaking. So again, most people will complain about it with certain activities, and they can normally like list off those activities pretty easily. And it tends to be less amount of urine. Again, not always, but it tends to be a less amount of urine leaking compared to the urge incontinence. Especially if it's a newer thing. Now, if it's something that has been going on for years and years, sometimes people will say, oh, I started out, I only leaked a little when I coughed a lot, and now I'm leaking a lot if I cough a little.
Right. And you can actually have both, too.
Yes.
We see that quite a bit.
So yes, the official term for that is mixed incontinence. A lot of times, what I have seen in my clinical practice is that it starts with stress incontinence. And again, not always, we're speaking generalities here. People start leaking a little bit with certain activities. And so they start purposely going to the bathroom more and drinking less. Which makes sense in theory that's going to help, but what it does long term is it actually messes with your brain bladder signals, and it essentially trains your bladder into that urge incontinence.
Right.
So if you're dealing with mixed incontinence, we always want to address the urge incontinence first. Everything's going to be addressed a little bit simultaneously because there's a lot of crossover. But that's the layer that we need to peel off first, and then start addressing that stress incontinence.
Right. We want to get back into those like really healthy habits that help keep our bladder really happy. And then we can start working on building on that layer of coordination and kind of building that pressure system so it works really effectively.
So again, we went through kind of what is different between urge and stress incontinence, but a lot is the same. Your pressure system needs to be coordinated. You need to know where your pelvic floor is and what it is doing. Is it contracted? Is it relaxed? If you go to cough or sneeze, it should reflexively contract. But in a lot of people, we've kind of lost that reflex, and we need to train it back in. One of the other things that we say is, an irritated bladder can be a leaky bladder, and that's for both urge and stress incontinence. Bladder irritants we really get into with urge incontinence, but at the same time, with stress incontinence, if that bladder lining is inflamed and agitated, it's going to worsen those symptoms as well.
I think a lot of people use kind of like, they're like, well, if I don't drink water, I'm not going to leak. Your kidneys are making urine 24/7, so you cannot dehydrate yourself to leak. In fact, if you drink more water than you think you need, this is actually going to help you out more in the long term. And it'll help with those, not only the healthy habits, but that brain bladder connection, which has been, thrown off because of these habits that we've developed.
So what are some bladder irritants? We mentioned them in the last slide, but what actually are they?
The big ones.
The big ones, yeah. Again, this is something that is personal for everyone, meaning that to know if something is truly a bladder irritant for you, you really need to cut it out of your diet completely for at least about 2 weeks and then see how things feel. So, but some of the big ones. So some people, citruses can be very irritating to their bladder. And even tomatoes are on that list because they're acidic.
Yeah.
For some people, dairy can be very inflammatory to the entire body. For a lot of people, the artificial sweeteners are problematic. Carbonation is problematic for a lot of people. Caffeine can be problematic. Although I have had some patients too where they've switched to decaf, which if you're doing a decaf coffee, there's actually a chemical process that they use to process the caffeine out of the coffee beans. And I have had some people where switching to decaf has actually made their bladder symptoms worse, and other people that it has made it better. So again, this is something that really needs to be a personalized recommendation. And sometimes the best way to kind of go about that is that trial and error. I'm going to take this out of my diet and see how I do. This is where a bladder diary can be really, really helpful as well.
Right.
If you're actually tracking what you're eating, what you're drinking, and then what are your bathroom habits like, you might see a pattern. You might see that after your morning coffee, your frequency pumps up to every half hour. And then as you get away from that morning coffee, it goes back down to that every 2 to 4 hour range that we want. Or maybe you don't see that at all. Again, we need to figure out your bladder personally. One of the biggest bladder irritants that often doesn't make the quote unquote list because it's not a food is dehydration. If you are dehydrated, that means that the urine that is in your bladder is very concentrated, and that concentrated urine is very irritating and agitating to that bladder lining itself.
So think about those short, frequent pees that you're having. Those really small amounts of urine are likely very concentrated, and that concentrated urine is irritating your urethra, that tube that comes out, and that's going to make you want to pee more often because your bladder is all flared up.
Alcohol. That's the other one. Yes, yes.
How did we forget about that?
How did we forget about alcohol? Yes, that is also one that tends to be irritating to the bladder and the urethra. One of the things most people don't keep track of is how much they're urinating at any given time. And you can get, they call it a hat. It's an actual measuring device that sits in your toilet, and you can actually measure your inputs and your outputs if you want to get that specific. I also tell people, because most people aren't into that, like count. So your urine stream starts 1, 1,000, 2, 1,000, 3, 1,000. Your urine stream stops. Your urine streams should not be starting and stopping. So if it is, again, that's something that maybe needs to be addressed at a personalized level. But if you were counting your urine stream, it should really never be less than 8 seconds.
What would be considered like a good void, if we wanted to use that nice fancy terminology?
A nice fancy terminology, yeah. So, I mean, again, it depends a little bit on your baseline bladder size. I have some people that, they feel like a good void for them is like 20 seconds. I have a lot of people that are more in like the 12 to 15 second range. But again, if you're like, oh my gosh, I feel like I have to pee really, really badly, and you rush and it's like dribble, dribble, dribble. Your signals are off. Something is telling your brain that you really, really need to pee, but when there's nothing in there. When you're not getting a full stretch bladder. And most of the time that's related to a bladder irritant or just habit. You've trained your bladder that it needs to go more and more and more frequently. Okay, awesome. So we covered some of those baselines there. Let's pop over to the next video and get some more information.